Hello, my name is Willem Verberg and I'm the clinical lead of MicroLife. And in this video, I'm going to explain you the WatchBP 03 ambulatory, which is the 24-hour blood pressure monitor from MicroLife, the one that you can see in the picture here. Before we start, I think it is important to mention that the device has passed all necessary validation criteria according to different international protocols, such as, for instance, the one of the BHS, but also the ISO AMI standards are fulfilled. In addition to that, the device has also been separately validated for patients who are pregnant and having preeclampsia, for patients with chronic kidney disease, end-stage renal disease, with the diabetes, and children from the age of 3. In addition to that, the device is also reliable for blood pressure measurement in patients with AF. The software is downloadable free of charge. I can demonstrate that to you in real life. Here you can see how you do that. You just go to the microlife.com website. Then you go to professional products. You click on software and then we get to WatchBP Analyzer. The reason it's called WatchBP Analyzer is that it is compatible with more models from MicroLife, such as the WatchBP Office, but today we are talking about the WatchBP 03. When you scroll down, you can see that the software is available in different languages, but we are only using the English language, so we go to the UK icon, click on that, and then the download automatically begins. Then you can go to the download file on your PC, click on the link there, and the installation starts. When the installation is finished, an icon will appear on your desktop. If you click on that, you will get to the WatchBP Analyzer software, which looks like this. Here you can see that are different languages available. The reason I tell you this is that it could be that by accident someone sets up another language, then you can recover it by going here and click on English. Of course, there is an instruction manual with the device in case you need some more information. This can also be downloaded from the website. It can also easily demonstrate you how to do it. You go to professional products again, select the device that you are using, click on it, and when you scroll down, you will see here that you can download the instruction manual. This is how the device is delivered. It has, next to the device, it has a pouch, a carrying bag, several tubes, and this may be needed if the patient is tall. Then you can extend the tube that belongs to the cuff. The device comes with a waist belt and with a shoulder strap, and also this depends on how you want to carry it, and a USB cable. Standard are included an M size and an L size cuff, like what you see here. There are two other cuffs available, the small cuff that goes from 14 to 22 centimeter, because the device is also validated for children from the age of 3. And there is an LXL cuff that goes to 52 centimeters, and that is separately validated. The M and the L cuff probably will cover the majority of all patients, as it goes from 22 to 42 centimeters. The cuffs can be washed in the washing machine, and the cuffs are available in both nylon and cotton. When you click on the icon, then the software starts, and When you connect the USB cable to the PC and the device, then the software automatically will detect the correct device. I can demonstrate that in real life. You can see now that it is disconnected. When I connect my device, you can see that it starts connecting and that eventually the software will automatically detect the WatchBP 03 and what is the ID of the device and also the latest user ID. And this is from the patient I programmed the last time. This is the patient list, but I presume that we are dealing with a new patient. So what we do, we click on the new button here, and then the patient information file shows up. And you have to fill out the patient ID. That can be any combination of numbers or characters. You fill out the name of the patient, the gender, date of birth, if you want the physician idea, and if you would like to send a report later on to either the patient or the physician, you have to register an email address here. Then click on OK, and then we go, now we have registered the patient. We select the patient that you can see here, it lights up in blue, and then we go to program the device. If you program the device, you can see immediately that we have to set the day and the night period. Day period means when does the day start. In other words, you ask the patient, what time do you get up? In this case, the patient mentioned that he or she gets up at 6 or at 8, whatever you can fill out here. And you do the same for the nighttime period. The patient here tells that he or she goes to bed at 10 p.m., so we fill out 22 here. And then we go to the minutes interval time. The minutes interval time determines how much time there will be between two measurements. In other words, it will determine the frequency of the measurement. We can choose between 15, 20, 60, or 30 minutes, but it is recommended by the BHS and the European Society of Cardiology guidelines to measure at least every 30 minutes during daytime, during nighttime. So you could choose, for instance, every 20 minutes during daytime, every 30 minutes during nighttime. Here we click on 20 minutes during daytime and 20 minutes during nighttime. Then the next thing we need to do is we have to set the highest inflation pressure. I would always recommend to set this on auto, because when you do that, then the device will automatically determine the highest inflation pressure that is needed for the cuff to detect the blood pressure values. Sometimes you could have good reasons to switch to manual. For instance, when you have to measure a child of 4 years old and you would like to prevent that the cuff inflates to a pressure higher than 180, then you can do that. But most of the time, auto is definitely recommended. Then we can choose to hide or not to hide the blood pressure reading. I would always recommend to hide the blood pressure reading, because the last thing you want is that the patient looks at the LCD screen every time the measurement has been done, because that will definitely influence the patient behavior. Then we have the option silent mode or not in silent mode. What does that mean? If I choose not to use the silent mode, then the patient will hear a beep 1 minute before each measurement takes place, only during daytime. And the reason for this is that you have to instruct the patient to keep the arm still during the blood pressure measurement. However, we also recommend that the patient continues his daily routine as normal as possible. So the patient also needs to go to, for instance, the supermarket or something like that. And for that reason, it is very important that you give a warning 1 minute before the measurement takes place so that the patient knows, okay, I will be measured in 1 minute and then I need to be capable of keeping my arm still. If you choose for silent mode, then the patient will not hear a beep, but will also get a warning 1 minute before the measurement takes place. But the warning will consist out of a soft inflation of the cuff, up to 30 millimeters of mercury or so that the patient feels that the cuff is inflated softly and that the patient will be measured in 1 minute from then. After you have done that, you click here on program and then you will get the message: programming the device will automatically clear all measurement data on the device. That means that the data that are on the device from probably the previous patient will be erased when I click on OK. So I click on OK, and then it says the blood pressure device is programmed successfully. So this is done now. What we need to do then as well is we need to check if the battery has sufficient energy to fulfill the 24-hour blood pressure measurement cycle. Here it says normal battery, so we are okay here. If it is not, if there is not enough energy in the battery, then it says here in red renew battery, and you have to replace the batteries. Then you can instruct the patient about the pill button. This is the pill button, especially when the patient takes antihypertensive drugs. You can ask the patient to push this button at the time he takes his medication so that it will appear later on the report. What you could also do is to mention this as a sort of event button. If there is a situation that may affect the patient's blood pressure, but the patient is not in the position to write it down in his or her diary, you can suggest to push the pill button for 3 seconds so that this event will be registered, and you can later on trace back when it happened and what was the blood pressure at that moment. Now you have to prepare the patient for this measurement procedure. So what you need to do is you hook on the cuff, and you do that by positioning it at 2 to 3 centimeters above the elbow. There is an artery mark on the cuff, and this artery mark needs to be at the position of the brachial artery of the patient. Normally the tube goes downwards, but now we are talking about 24-hour blood pressure measurement, so the tube of the cuff goes upwards over the neck to the other side, and there it is connected to the device. In this case, the device is carried with the shoulder strap, but you could also choose to carry it with a waist belt. This could be either the waist belt that is delivered with the device or the patient's own waist belt. Before sending away the patient, we recommend you to take a test measurement, and for this you have to switch the shift button to casual. And when you do that, you push the button, the start button, and see if the measurement goes well. If that is the case, then you switch back the shift button to ambulatory. And this is at the side of the device, as you can see here. And it is very important that you shift it back to ambulatory. Otherwise, there will be no measurement taken. And if you have done that, then the patient is ready to go. When the patient comes back after 24 hours, you do the same again, and you connect the device to the PC with the USB cable, and then you can click on download. And the device will immediately detect the ID in the software of the computer. That means if you have registered the patient on that computer. If you have registered the patient on another computer, or if you read out the data on another computer, it will only detect the ID here. You click on download and then it says progress 100%, and here you can see that these are the blood pressure measurement taken. For this purpose, I use virtual data, so do not take any notice of the unusual data that you can see here. What is important to mention is that the date and the time of each individual blood pressure measurement is registered. SYS stands for systolic blood pressure, DIA is diastolic blood pressure, MAP means mean arterial pressure. This is the pressure roughly in between systolic and diastolic. I can explain that in more detail, but I do not think it is very relevant for this purpose. PP means pulse pressure, which is the difference between systolic and diastolic blood pressure. And we have AFib. The device is capable of detecting atrial fibrillation, which means that each time the device detects atrial fibrillation during a blood pressure measurement, it will put a mark next to the blood pressure value. You can see here that you have the possibility to exclude certain blood pressure measurements. You probably will not use that very often, but this is an option because sometimes patients have experienced something that largely increased their blood pressure and which is not representative for their usual blood pressure, so you could consider to exclude that. Further, the report also registers the errors that in case there is an erroneous measurement and there is no blood pressure taken at that time. And the interesting part is that it also mentions the type of error. And this is very helpful in solving problems. For instance, an error 3 indicates that there is no cuff pressure because there is a tube leakage. Error 2 most of the time indicates that the patient did not keep the arm still during the blood pressure measurement. So the patient should have had better instructions than that. Now we have seen all this, we can go to report to generate the report. And we have two options for this. We can generate a PDF report and we can generate an Excel report. I get to that later. But before we make the report, we have to set the actual awake and asleep time. And this is important because the day before, we asked the patient, what time do you go to bed? And the patient said, for instance, well, I go to bed at 10. But today, he or she says, no, I went to bed at 12. So we need to adapt that because the report will calculate the average blood pressure value for day and night separately. And we do not want these results to overlap. So we asked Now the patient again, what time did you get up? What time did you go to bed? And we click on the right time. Then we are going to generate the PDF report, and it shows automated comment. And this is a tool to support the treating physician as it helps to diagnose. Of course, it does not take over the diagnosis, but it can really support the treating physician. For instance, nocturnal hypertension means that the blood pressure was too high during nighttime. In addition to the existing comment, you can provide your own comment if you wish, and then you click on Save. Then we can also generate an Excel report. Oh, before I go further, I forgot to mention that there is another report option. You can hide the error and event messages. That might lead to a nicer report, but it is not very practical. So I always would recommend not to tick this box on. You could hide atrial fibrillation results. Why would you do that? Well, sometimes if you, for instance, measuring a pregnant woman, many pregnant women experience irregular heart rhythms during pregnancy, and this may lead to false positive findings. So in that case, the atrial fibrillation detection system is not reliable, and you can exclude the results of that. Average without first measurement is not very relevant for this report, so I would ignore this. So then you go to generate the Excel report, and that is a more simplistic report, but very useful as it's when you only want to have the raw data. What I also forgot to mention is you see an icon here, a logo here. You can have your own logo on the report and it's very easy to do. You click on the button here, select image, and you go to the picture of the logo, and it will be uploaded in the software, and you only have to do that once, and from then on the logo will always appear on the reports. This is the PDF report. It's very clear one-page report. Everything you need to know is on the report, and it is very helpful, and the graph gives a very good indication of the patient's blood pressure. The blue bar indicates the nighttime blood pressure. The gray bars are the normal value bars. For instance, the blood pressure threshold during daytime is 135 for systolic during daytime, and during nighttime it is 120. So you can immediately see if the patient blood pressure falls within the normal bars. This is for systolic blood pressure, this is for diastolic blood pressure. Here you can see when the patient has pushed the pill button. These are the average blood pressure values. When the blood pressure values are above the normal values, then it is colored in red. The SD stands for standard deviation, which is a measure of variability of the blood pressure data. Here you can see the raw data with the time. And when the blood pressure values are too high or above the normal values, then these are colored in red. Here you can see the automated comment. And the white code window these are the blood pressure measurement from the first hour, and this is analyzed separately because during the first hour of blood pressure measurement, patients may have a higher blood pressure than usual. So you might want to take an extra look at that. What is also very important is that the number of readings, number of successful readings is above 70% as is recommended by the guidelines. If it's below 70%, it will be colored red and you may consider to perform the blood pressure measurement again. Nighttime dipping percentage means how much the blood pressure lowers during nighttime as compared to daytime, and this usually should be 10% or higher. If you would like to have further support for the software, then you could go to in the software interface, you click on the button About, and then you go to User Manual, and you click on that, and you get the WatchBP Analyzer User Manual. Further, there are some instructions in the user manual for how to clean the device. It's mentioned in the instruction manual what are the detergents that you can use and how you can clean it. These are the cuff plugs that I was talking about. These prevent water from floating into the tubes, and for washing in a washing machine you can take out the bladder of the cuff and then do it in the washing machine. I hope this instruction was useful. If you have any further questions, you can always contact us at watchbp@microlife.ch. Thank you for attention and goodbye.